name is Kevin Omondi Ndede. I currently practice as a consultant physician with interest in the field of cardiology. I currently am working as a lecturer at the Kenya Methodist University, that is in the eastern part of Kenya. But I also do some part-time clinical work in a cardiology clinic at the Nairobi Hospital. The clinic is named Prime Care Heart Clinic. The course I undertook was the postgraduate diploma in Preventative Cardiovascular Medicine, and I will be progressing beginning April to the MSc component of the course. Heart conditions are actually on the rise in our country. We know that they are being fueled by diabetes and hypertension, which we know are on the rise. And therefore, we expect that with time, these heart conditions such as ischemic heart disease, heart failure, all of this is going to increase significantly in our country. The challenge we have is that there are very few people who are specialized in the field of cardiology, and therefore there are not enough people to take care of these patients. So there's really a need to increase the training of individuals who will take care of these patients. So I have had the opportunity to study the Master of Science in Preventive Cardiovascular Medicine, a course from the University of South Wales that was sponsored by the Merck Foundation. So the structure of the course is an online model where you do theoretical coursework for a duration of 1 year. And then the second component is a research-based project, which constitutes another year. From my studies in the first year of the course, I was able to learn a lot about preventive cardiovascular medicine, ranging from hypertension, diabetes, cholesterol disorders, obesity, smoking, and dietary aspects, physical activity. All of these factors collectively impact on cardiovascular health. And so the first benefit that I have accrued from this course is that I am now better able to manage my patients, considering all these factors and knowing how they interact in the causation of cardiovascular disease. So I take a bit more keen interest in looking out for these risks in the patients that I see and addressing these individual risks. Of course, the second important aspect is the course has been quite impactful, and I intend to continue my growth in the field of cardiology. My ultimate goal is to actually study electrophysiology, and I think the background of preventive cardiovascular medicine will become very important even as I apply for other opportunities to study a bit more of cardiology. So I think in that respect, in my career, it is going to impact a lot on my chances of getting other opportunities in training. Over the 1 year of the online diploma component of the course, I was able to learn a lot about the interactions of different conditions, including diabetes, hypertension, unhealthy diets, smoking, and how all these conditions impact on cardiovascular health. So the understanding of these conditions and risks for cardiovascular disease will help me better evaluate patients. They will help me to risk stratify, because one of the things that previously I was not doing very well was to stratify the risk of cardiovascular disease among the patients that we see. The institutions that I work for have acknowledged the diploma I received in Preventative Cardiovascular Medicine from the University of South Wales, and this course was sponsored by the Merck Foundation. As part of the acknowledgement and of the new skills and knowledge that I have acquired, one of the clinics that I mentioned that I work in has now given me and a colleague of mine from the same course the mandate to start a preventive cardiovascular medicine clinic as part of the regular clinics that are run in the facility. And so we are already seeing some of the benefits and impacts of this course on patient care. A few of our patients have already noticed a change in the approach that we take, because you realize the patients we see are mostly repeat patients. So previous consultations have been brief and focused really on taking medicine to treat the current condition. However, majority are beginning to realize that we are a bit more diverse. We ask them more questions concerning their cardiovascular health and the risks that they might have. And we are also spending a lot more time discussing how they can reduce the risk of the illnesses that they have. So in that respect, quite a number have already noticed, and they are quite appreciative that we are doing the extra mile to try and assist them prevent serious complications from their illness. Finally, I would like to pass my sincerest gratitude to the Merck Foundation for their sponsorship to study this course, the Diploma in Preventive Cardiovascular Medicine and the MSc in Preventive Cardiovascular Medicine from the University of South Wales. I really appreciate their financial support because without that, the costs of studying this course would have been quite unaffordable to me. And I would highly recommend this course to my colleagues across the world, everyone who is in the space of cardiovascular care. This is a good course that you can do online and improve a lot of your knowledge, and that will impact on how we take care of patients. And we also like to really encourage the Merck Foundation to continue the good work of sponsoring more health practitioners, because that is how we will make a difference to people's lives. Thank you.